Hello, everyone. This is Dr. Mike Show, physical therapist. And yes, we are here with Miss Joy Evans. She's a hospice care consultant for Gentiva. We're going to ask her who she is, what does she do, and then we'll be back in a few seconds, okay? We are back here at where are we at?
Wesley Fountain.
There you go.
Assisted Living.
There you go. That's the first stage, forgetfulness. Wesley Fountain Assisted Living. But we are here with Miss Joy Evans. She is from hospice. She's a hospice care consultant from Gentiva. I just want to ask her who she is, what does she do, and everything like that. So, could you please tell us what do you do?
Sure.
Mhm.
I am a care consultant for Gentiva Hospice
Mhm.
out of Jackson, Tennessee.
Okay.
We were formerly Avalon Hospice.
So what happened?
Everyone in the area knows us as Avalon.
Mhm.
Gentiva.
Service, I assume.
Same
Mhm.
services, yes.
There
We
you
are
go.
the largest hospice company in the nation.
Mhm.
We are very, very proud of that. We have some of the best nurses and CNAs, social workers, chaplains. We just have a whole team of support that we can bring in for the family and the patient.
There you go. So let me ask you this: how does one qualify? I know a lot of people are asking, when we hear the word hospice, it's so bad and everything, but how does one qualify to get hospice care?
Well, one of the main qualification is a patient does have to have a diagnosis or a terminal illness
Mhm.
with 6 months or less to
Mhm.
live to be able to qualify for hospice. But providers are referring to hospice earlier now. They are seeing the benefits that hospice has to have that early admission because we are able to come into the home or the assisted living, wherever the patient is where we're going to come and service that patient.
Mhm.
But we are able to provide the best quality of life for that patient that with the time that they have left.
Mhm.
And a lot of times the family needs as much support as the patient.
So true.
We bring our nurse in on the days the nurse isn't there. We can bring a CNA in to help with grooming and bathing and those types of
Mhm.
needs. And then we also have amazing social workers that are just phenomenal. They actually can even help families set up funeral arrangements,
Mhm.
maybe get services set up for the patient that the patient doesn't even know they qualify for.
Mhm.
So we do have a veterans program also. The VA, the Tennessee State VA Humboldt skilled nursing facility here in Humboldt, Tennessee, we service that building.
Mhm.
And we have there are lots of activities and things that we offer for veterans as well, as far as benefits go.
I was going to ask you that you were are you supporting families too? But you also mentioned that because most of the time, the people who needs help, yes, the patient, the client really needs help, hospice care, but actually sometimes it's the family that really needs support. They go to these different stages of denial, anger, bargaining, and depression, and they're the one who needs really support. And then that's where the hospice company comes in. They're not there just to really support you and assist you in moving it forward and going to that end stage of acceptance where you're going to accept. Yes, we don't want to rush that to the stage of acceptance, but they will guide you through this process. It's a process. Some people,
it's a journey.
It's a journey. It's not about the destination. It's about the journey. And yes, it's a lot of people we talk about. My dad, we switched him to hospice. So a lot of people talk about that. Oh, we talk about hospice. No, some patients, they go past 6 months.
Oh, absolutely. We have a patient on service well over a year.
Yeah.
She's been on service with us.
So they can also
Absolutely.
actually still receive therapy. You know, you can still get physical or occupational therapy provided that you're treating a different diagnosis, not that hospice diagnosis. So going back to Gentiva, Miss Joy, where can they reach you? Where they can find you? You know, get a website, your office, or stuff like that.
Yes, our office in Jackson, we are actually moving offices, but I can always be contacted. My email is joy.evans@Gentiva, GENTIVAHS.com. Or you can call myself anytime, 731-676-8494. I work 7 days a week. I'm available for consults. A lot of families just need information because there are so many misconceptions with hospice. We don't just come in and put mom on morphine and then she passes away. That's not what we do. We don't offer pain meds unless the patient needs the pain medication or the family requests it. That has been one of the biggest misconceptions that I hear. Oh, you're just going to come in and put mom on pain medicine and she's not going to even know who we are and then she's going to pass away. We don't operate that way. We want that patient to have the best quality of life they can possibly have, and we are just blessed to be a part of our patients' journeys.
That's good. That's good. Well, again, thank you very much, Ms. Joy. I appreciate you. But before I let you go, always remember the word FAST, F-A-S-T, letter F. Find people that will bring out the best in you because you are the average of the 5 people you hang out with. Today, I hang out with Ms. Joy. And of course, if you want to find a hospice agency or a company that will bring out the best in your loved one, guess what? Reach out. So that's the first letter F. Next letter is letter A. Take action. All this stuff that we're doing is not going to do me good. It's not even going to do her good if you don't take action. Take action by reaching out to her. If you have a loved one that needs hospice care, and again, reach out. Just talk. Hey, does my mom, my dad qualify for hospice? And then, will my insurance pay for this? Is my long-term care insurance will pay for it? She will explain it to you. Next letter is share and subscribe. The more shares, the better. The more subscription, the better. Why? Yes, we make money with doing that, but no. We want you to share it. Why? Because if your friend or your aunt or your whatever friend that you have, oh, that lady can help me out, share that. It doesn't necessarily mean for our views or whatever. And last but not least is letter T. You teach it. Why? Because when you hear it, you forget. When you see it, you remember. Yes, we're teaching it, like what Ms. Joy is doing. You understand it more, and that's how you understand hospice care. Again, thank you very much. We appreciate you. Be awesome, be great, be excellent, and we'll see you in the next episode of the Jerry Hab Show. We're back.
Thank you.